Endometriosis is a medical condition that occurs when the tissue that normally lines the inside of the uterus, endometrium, grows outside the uterus. This misplaced endometrial tissue can be found on organs such as the ovaries, fallopian tubes, outer surface of the uterus, and other pelvic structures. In rare cases, it may even spread to distant organs outside the pelvic region. Pathology. The exact cause of endometriosis is not fully understood, but several theories exist. One common theory is retrograde menstruation, where menstrual blood containing endometrial cells flows back through the fallopian tubes and into the pelvic cavity instead of being expelled from the body. These cells then adhere to the pelvic organs and continue to respond to hormonal changes during the menstrual cycle, causing them to grow, break down, and bleed, just like the normal endometrial tissue inside the uterus. Over time, this process can lead to the formation of adhesions, scar tissue, and inflammation, which may cause pain and fertility problems. Causes. The exact cause of endometriosis is not fully understood, but several theories have been proposed to explain its development. It's likely that a combination of factors contributes to the condition. Some of the leading theories and factors associated with the development of endometriosis include 1. Retrograde menstruation. This theory suggests that during menstruation, some of the menstrual blood containing endometrial cells flows backward through the fallopian tubes and into the pelvic cavity instead of being expelled from the body. These cells then implant and grow in the pelvic region, leading to endometriosis. 2. Genetics. There appears to be a genetic predisposition to endometriosis. If close family members, such as mothers or sisters, have the condition, an individual's risk of developing endometriosis is higher. Certain genetic factors might influence how the body responds to hormonal changes and inflammation, contributing to the development of endometriosis. 3. Immune system dysfunction. A dysfunction of the immune system could play a role in the development of endometriosis. Normally, the immune system helps to clear out any misplaced endometrial cells. However, in individuals with endometriosis, the immune response might be compromised, allowing these cells to implant and grow. 4. Hormonal imbalances. Hormones, particularly estrogen, play a central role in the menstrual cycle and the growth of endometrial tissue. Imbalances in hormonal levels or the body's response to hormones could contribute to the development of endometriosis. 5. Embryonic development. Another theory suggests that cells in the pelvic cavity might transform into endometrial-like cells during fetal development. These cells can then respond to hormonal changes and lead to the growth of endometrial tissue outside the uterus. 6. Environmental factors. Exposure to certain environmental toxins, pollutants, and chemicals might increase the risk of developing endometriosis. These factors could potentially disrupt hormonal regulation and immune function. 7. Inflammatory factors. Inflammation is associated with endometriosis. It's possible that inflammatory molecules could promote the growth and adhesion of endometrial tissue in abnormal locations. Signs and symptoms. The symptoms of endometriosis can vary from person to person. Certainly, here are the common signs and symptoms associated with endometriosis. 1. Pelvic pain. Persistent pelvic pain is a hallmark symptom of endometriosis. The pain can vary in intensity and might be dull, cramping, or sharp. It's often more pronounced during menstruation but can occur at any time during the menstrual cycle. 2. Painful menstruation. Dysmenorrhea. Severe menstrual cramps that are not adequately relieved by over-the-counter pain medications are a frequent symptom. This pain can radiate to the lower back and thighs. 3. Painful intercourse. Dyspareunia. Pain or discomfort during or after sexual intercourse is common in individuals with endometriosis. This pain can be deep and might persist even after the sexual activity has ended. 4. Chronic pelvic pain. Ongoing pelvic pain that occurs outside of the menstrual period is a significant symptom. This pain might interfere with daily activities and quality of life. 5. Painful bowel movements or urination. Pain during bowel movements or urination, particularly during menstruation, can be indicative of endometriosis affecting the organs in the pelvic region. 6. Heavy or irregular menstrual bleeding. Experiencing unusually heavy periods, menorrhagia, or irregular bleeding can be a sign of endometriosis. 7. Gastrointestinal symptoms. Some individuals with endometriosis might experience gastrointestinal symptoms such as bloating, constipation, diarrhea, or nausea, particularly around their menstrual periods. 8. Fatigue. Chronic pain and other symptoms associated with endometriosis can lead to fatigue and decreased energy levels. 9. Infertility. While not a symptom in itself, infertility can be a consequence of endometriosis. The condition can cause scarring and adhesions that interfere with the normal function of the reproductive organs. Diagnosis. Diagnosing endometriosis can be challenging and typically involves a combination of the following. 1. Medical history and symptom assessment. The doctor will ask about your symptoms, menstrual cycle patterns, and family history. 2. Pelvic examination. The doctor may perform a physical examination to check for abnormalities or masses. 3. Imaging tests. Ultrasound or MRI scans may be used to visualize the pelvic organs and detect endometrial growths. 4. Laparoscopy. This is the most definitive diagnostic method for endometriosis. It involves a minimally invasive surgical procedure where a small camera, laparoscope, is inserted into the abdomen to directly visualize and biopsy any endometrial growths. Certainly, several risk factors are associated with an increased likelihood of developing endometriosis. These risk factors can help shed light on the potential factors that may contribute to the development of the condition. 1. Family history. If a close family member, mother, sister, has endometriosis, your risk of developing the condition is higher. This suggests a genetic predisposition to the disease. 2. Age. Endometriosis often occurs during the reproductive years, typically between the ages of 25 and 40. However, it can affect women of any age. 3. Menstrual history. Starting menstruation at an early age, before 11, or having shorter menstrual cycles, less than 27 days, might increase the risk of endometriosis. 4. Menstrual flow. Having prolonged or heavy menstrual periods, menorrhagia, or experiencing periods lasting more than 7 days might be associated with an increased risk. 5. Reproductive factors. Women who have never given birth, nulliparity, and have never breastfed may have a higher risk of endometriosis. 6. Retrograde menstruation. As mentioned earlier, retrograde menstruation, where menstrual blood flows back into the pelvic cavity, is considered a potential cause of endometriosis. Women with retrograde menstruation may have a higher risk. 7. Abnormal uterine structure. Certain anatomical conditions, such as having a uterus with an unusual shape, may increase the likelihood of endometrial tissue implanting in abnormal locations. 8. Immune system factors. Immune system dysfunction or deficiencies might influence the development of endometriosis. 9. Ethnicity. Studies have shown that endometriosis is more common among women of Asian and Caucasian descent. It appears to be less common among women of African descent. 10. Environmental factors. Exposure to certain environmental toxins, pollutants, or chemicals might increase the risk of endometriosis, although more research is needed to establish clear connections. Treatment. The treatment of endometriosis aims to alleviate symptoms, improve quality of life, and address fertility concerns if applicable. The choice of treatment depends on factors such as the severity of symptoms, the extent of the disease, the individual's age, and their desire for fertility. Treatment options include 1. Pain medications. Over-the-counter nonsteroidal anti-inflammatory drugs, NSAIDs, like ibuprofen can help manage pain associated with endometriosis. Prescription pain medications might be prescribed for more severe pain. 2. Hormonal therapies. Birth control pills, hormonal birth control methods like oral contraceptives, patches, or vaginal rings can help regulate the menstrual cycle and reduce pain. Progestins, these synthetic versions of the hormone progesterone can suppress the growth of endometrial tissue. Gonadotropin-releasing hormone, GnRH, agonists, these medications induce a temporary menopause-like state by reducing estrogen levels, which can shrink endometriotic tissue. Their use is usually limited to a short duration due to potential side effects. Danazol, this synthetic androgen can inhibit the growth of endometrial tissue, but its use is limited due to potential side effects. 3. Laparoscopic surgery. Conservative surgery. Laparoscopy can be used to remove endometrial growths, scar tissue, and adhesions. This is a common approach for symptom relief and fertility preservation. Excision surgery, a specialized surgical approach that involves removing endometrial lesions while preserving healthy tissue. It's often considered more effective for symptom relief compared to ablation techniques. 4. Hysterectomy. In severe cases or when other treatments have been unsuccessful, a hysterectomy, removal of the uterus, might be considered. This option is typically reserved for cases where fertility is no longer a concern. 5. Assisted reproductive techniques. For women with endometriosis-related infertility, assisted reproductive technologies such as in vitro fertilization, IVF, can increase the chances of conception. 6. Complementary therapies. Some individuals find relief from symptoms through complementary therapies like acupuncture, dietary changes, and stress management techniques. While these approaches may not treat the underlying condition, they could provide some relief. It's important to note that treatment choices should be made in consultation with a healthcare professional, ideally a gynecologist or a specialist in reproductive health. The best treatment plan will be tailored to the individual's specific situation and goals. Additionally, since endometriosis is a chronic condition, ongoing management and adjustments to the treatment plan might be necessary to address changing symptoms and needs over time. Subscribe to get more related content.